Here's a reason why the criteria we have don't work too well. We did a study published last year that estimated for the entire country the prevalence of two things coming together. The conjunction of impulsive, angry behavior. These are the kinds of people who, when they get angry, they break and smash things and get into physical fights. I mean, I understand that anger is a normal human emotion. Everybody gets angry. Of course, when I get angry, it's called righteous indignation. But everybody gets angry. But these are people where the anger is destructive, it's unpredictable, and the second thing is access to guns. So it turns out 9% of the adult population in the United States, according to this big epidemiological survey, have impulsive angry behavior and access to guns at home, and 1.5% have impulsive angry behavior and they're carrying a gun around with them. Now, I think on the face of it, that's a bad combination. Now, are these individuals mentally ill? Well, that depends on what you mean by that. They do meet criteria for psychopathology, but it's not things like schizophrenia. It's personality disorders, it's alcohol, it's fear and anxiety. And it's not the sort of problem that people get involuntarily committed for. And in fact, under 10% of the people in these risky groups have ever been in a hospital for a mental health problem. So they're not going to get ensnared by our criteria of involuntary commitment. That's not going to work very well. We're going to need a different approach. Now, they might have something like a misdemeanor violence conviction. In many states, that does not confer a prohibition from firearms. In California, it does, and they have lower gun fatality rates than other states. I think that would be a good thing. It's one of the recommendations of our Consortium for Risk-Based Firearms Policy. This slide, this pie chart here, illustrates two problems, two aspects of this problem. These are data right here from Florida, from our study in Pinellas and Dade County, and what you're seeing here are data from 1,206 people with serious mental illnesses who committed a violent crime with a gun within over a period of 10 years. And what the pie does is it tells you whether when they did that, were they legally able to possess a gun or not. It turns out 28% of them were not gun prohibited. Well, that's a problem with our criteria. If we had a good crystal ball, we could know that these people were going to commit a violent crime, we could say you can't have a gun. But look at this problem here. 62% of them were legally not able to possess a gun on the day they used one to commit a violent crime. And they had a gun anyway, right? They got a gun anyway. They didn't need this. That's the problem. If you have 40% of the gun transfers taking place outside the background check system, and we live in a country where we have 97 guns for 100 people on average, then we're going to need a different approach. And that's where an innovative law like a risk warrant, we call it, or a preemptive gun removal law, which gives law officers and sometimes family members a tool with due process to remove guns from people at the times when they're dangerous, might have a different result. These are basically the same pattern of data, but these are 50 people who ended their own life with a gun. 50 gun suicides. Here you see 72% of them were not gun prohibited. They could walk into a licensed gun retailer on the day they used a gun to end their life, and they would have been passed a background check. Now, 28% of them already were prohibited, and they got a gun anyway. That's the problem there. There's another way of looking at this. This is a kind of a public health opportunity. It turns out that here in Florida, 34 of those people, of those 50 people who committed suicide with a gun, had a short-term involuntary hold where they were actually detained and brought in there under Florida's Baker Act for a short period of time for an evaluation, but one that did not progress to a gun disqualifying involuntary commitment. Now, there's no reason we couldn't say, as some states do, let's use that as a disqualifier and temporarily separate people from guns in that situation, using it as a marker of elevated risk. So yes, were they potentially dangerous? Yes. Were they known to the system? Yes. Were they gun disqualified? No. There are times when we know that risk is elevated in people with mental illness and the sort of history of the career of illness and treatment. And if you look over there, these are bar graphs that summarize the prevalence of violent behavior in people with mental illnesses organized by the setting in which these studies have been done. So it's an average, a meta-analysis. You can see for comparison there that on the left, the 2%, that's the general population, the estimate of do something violent in a year. It could be anything from simple battery to injuring somebody with a gun, or anything in between. And 8% is outpatients in treatment, some of whom are actually brought into treatment because of concern. Some are being treated, and others not necessarily so consistently. Now, as we start to move to the right-hand side of the graph, and we look at studies that have been done in the settings when people encounter the mental health care system in a crisis, now the prevalence estimates go up. Emergency departments. That's not surprising. Sometimes people are brought into emergency departments because there are concerns with risk of harm to others or self. Involuntarily committed patients, 36% of them have been violent towards others in the lead up to the involuntary commitment. Now, the majority have not, but that's a time when risk is elevated. And then first episode psychosis patients, 37%. Now that's interesting too, because if our approach to try to, limit firearms access to people who are dangerous is to look at red flags in a record, and they don't have a record because they haven't even presented for care yet. They're just out there with this psychosis untreated, then that won't work so well either. So, I don't know what the solution is for every single state, but I think there are some principles that should guide our efforts in reform. The first one is, I think we should prioritize contemporaneous risk assessment based on evidence of behaviors that actually correlate with violence and self-harm at specific times, not focus so much on this broad category of mental illness, which is too nonspecific. History of violence, as I say, is a far better indicator of future violence. So if somebody has a misdemeanor violent crime, or let's say someone might have a history of multiple DUIs, we know that that's correlated with violence. Those individuals could be prohibited from firing, temporarily perhaps, with an expedient opportunity to get their gun rights back if they don't pose a risk to public safety. Second is we need to do something about preempting existing gun access from people who already have guns, because if all we do is we stop someone from purchasing a new gun from a licensed retailer, meanwhile, they have lots of guns at home. And in the data I showed you about impulsive angry behavior, people who have at least 6 guns are substantially more likely to be in that risky group where they're angry and impulsive and carrying a gun around with them. So again, stopping somebody from buying a new gun is not necessarily going to do that. Third, provide legal due process. I mean, this is the country we live in. We need to think very carefully about making sure that we don't, in an unwarranted way, trample on the rights of lawful gun owners. And that's important not only legally but politically, because this is a radioactive topic. And you know what? People think that we're all so polarized on this, and we are. But there's a big common swath of real estate between people who disagree on the politics of gun control but do not fundamentally disagree that somebody who's really dangerous should not have their hands on a gun. That's actually a good place to start. Then we figure out how to do that. If we could legislate on the basis of public opinion instead of the extreme voices that you hear from the gun lobby, we would be in a different place. And number 4, preserve confidential therapeutic relationships. If we're going to contemplate using the mental health workforce as some kind of surveillance network, some kind of gun gatekeeping, we need to think very carefully about that, because you could overreach and, pass some crisis-driven law where you say, doctors and counselors have to report people who are dangerous to the police so that we can, find out if they have a gun. Well, that might have a chilling effect. It might keep people away from treatment. It might do something like, inhibit disclosures of suicidality. And doctors and clinicians already have a lot of tools available. So that's something we need to think very carefully about. And finally, as I say, we can't find the needle in the haystack. Let's think about the haystack in the needle, and let's think about preventing the unpredicted. Universal background checks is a good thing, because a lot of policies won't work unless we have that. But also, what about the social determinants of violence? Get upstream, think about having healthier communities with a better social safety net, fewer people, kids exposed to trauma who grow up to be perpetrators, things like this. Better access to mental health treatment and substance abuse treatment when people need it. Use some of the money we're spending on interdiction and make treatment for substance abuse more available in the community. If we did some of these things, and we have to do more than just one thing, because this is not a one-thing problem, and it's not a one-thing solution. There's not going to be a great big headline in the newspaper that says, better background check system, better social safety net, and better access to treatment, prevented mayhem on Thursday. But if we actually did that, and we lived in a less violent world, why would that? Thank you very much.
Hear, hear.
A question or two? No questions? All right. Yes, sir.
On the subject of universal background checks, if they're not working now, how would you improve them to make them functional?
Well, I think they're not working because we don't have them. And even in states that do have universal background checks, the few states that do,
Like Oregon.
yes, people can get guns in a neighboring state. There's evidence that shows that crime guns are often not purchased in the state in which the crime was perpetrated. So I think we really won't know the answer to whether universal background checks work until we have a pretty good not only implementation of that, but again, the background check is only as good as the records that are in the background check system. So on the example with mental health records, if we're reporting histories of involuntary commitment and the only reporting authority is the state mental health authority, and they're just talking about the state institutions, and meanwhile the whole system has been privatized now, and people are being committed to private institutions, the state has no idea. You're going to get committed, you're going to lose your gun rights if you are an indigent person in Medicaid in the state system, and you might not. The same person who is a bank vice president with bipolar disorder gets admitted in a private facility. So I think we need to think about the records that are in there more comprehensive and having this in more states, and then we would know. But that's my view. Thank you for your question. Yes.
Excellent presentation. Thank you so much. So here's this great research that you're doing, and here's the stuff that's going on, and then we have stuff that's happening on Capitol Hill. How is what you're doing translating to policy making that might be going on with our state legislatures, Congress, and so forth? And are there champions out there that can take some of this research and actually do something with it in terms of making policy?
Great question. There is this perception that nothing is happening about this. After Sandy Hook, there was all this talk and nothing happened. Well, that's sort of true at the federal level, but at the state level, which is where a lot of this has to happen with local police, local prosecutors, local systems, more than half the country now lives in a state with stronger and more sensible gun control, gun laws than we had beforehand. And some people don't like the term gun control, but I mean laws that do not run afoul of the Second Amendment. I'm part of a group called the Consortium for Risk-Based Firearms Policies. We've issued 2 reports, one for federal policy and one for state policies. We have a whole series of recommendations for states. And things are happening. One example is the gun violence restraining order that was passed in California after the Elliot Rogers shooting. That's an example. Someone, his family were concerned about it. They knew he was disturbed. They called law enforcement to come pay a social welfare check on him, and they couldn't really do anything because he didn't meet the criteria under California's 5150 law. The gun violence restraining order puts a tool in the hands of family members and law officers to remove guns from dangerous people during the time when they're dangerous. And in my hometown of Chapel Hill, North Carolina, we had the poster person for this, Craig Stephen Hicks, who shot 3 Muslim students in the head. If people knew he was the angry man, he had guns, and there was nothing that could be done. This is the kind of law. And several states, probably 6 or more states now, are either proposing or have proposed legislation similar to this. So that's one example.
Hi, back here.
Okay.
Not necessarily a question, it's more a suggestion. I feel like a lot of the people that suffer with mental illnesses, they usually get help with psychologists or behavior specialists. And I was wondering, is there a way where they can work closer with law enforcement? Because I feel like those information are usually private, but if more law enforcement and shows more in court documents of what they're capable of doing, even if they haven't done it, I think we can keep more of an eye on their not necessarily their everyday life, but what we can expect instead of it just happening and then we're like, oh my gosh, he had a mental illness. We had no idea he'd go that far. Instead of the psychologist or whomever they're working side by side with in very close settings, if we can share that information with law enforcement or be very open about the possibility or even ounce of what they're capable of doing instead of waiting after it happens. I don't know if it makes sense.
No. Let me just answer that by saying that I certainly agree that law enforcement, the police, are extremely important. They play a very important role, as you might say, mental health first responders, where people are in a mental health crisis, where they might pose a risk to others or themselves. And when I talk to law enforcement and I say things like, the vast majority of people with mental illness are not violent and don't pose any risk, they say, well, those aren't the people that we see, because they're seeing people who are in a crisis. I think one of the important things is a really important, I guess, movement, you could say, to train law enforcement officers to understand more about mental illness and have a close working relationship with mental health professionals, called crisis intervention training, and these programs are being disseminated all over the country. And I think we need more research about how they work, but I think they're very important. We do need to think carefully about problems of confidentiality, but having a better integrated linking relationship between law enforcement and mental health professionals is very important, and I support that. Thank you very much. All right, I think that's all. Thank you.
Swanson, thank you again for the very informative presentation. And remind the audience that again at the end of each of the presenters' words, you'll be able to ask a little brief question and answer period following that. But as the program continues to evolve, know that at the end of all the presentations there will be a more extended period. So if you continue to think of questions for any of the presenters, know that you will have the opportunity to present them at that point in time. We are honored to have with us this morning Jane Castor, who is the former City of Tampa Chief of Police. And we're glad to have her speaking with us today about issues facing law enforcement today. Ms. Castor.
Well, good morning, everyone.
Morning.